Okay, before we kick off with the show proper, I want to remind you about the water treatment therapy, where you wake up in the morning and you take your 4 glasses of clean table water. You wait for 30 minutes before you have your breakfast, and then when you finally eat your breakfast, you wait another 30 minutes before you drink water. This is to aid digestion, okay? And don't forget not to drink water while you eat. So that means you have to chew properly so you do not choke, all right? That done, ladies and gentlemen, I want to welcome my first guest to the show. He is the medical director at True Care Fertility Clinics right here in Lagos, the center of excellence, okay? Ladies and gentlemen, this particular doctor is very close to my heart because, you know, he has all the answers to a lot of questions that we've been receiving from viewers. People have been calling, sending in text messages and emails about semen coming out after meeting, you know, with their spouses. Inappropriate lactating, that is, you know, water is coming out from your breast when you're not breastfeeding. Then hormonal imbalance, ectopic pregnancy, D&C, and staphylococci. So many other issues. So we have decided to bring him to our studios to take all of this, and we just pray that time will permit us. Viewers, let us welcome to our sets the one and only Dr. Akiniyi, who is the medical director at True Care Fertility Clinics. Doctor, you're welcome.
Thank you, madam. And good morning, viewers.
Okay. Good morning to you, too.
Good morning.
All right, so all of these issues that I raised have been, you know, bombarding our emails, our texts, our phones. Nigerian women are having these issues, and we want you to please just explain so that, you know, they can have information, because information is power. If the women know what to do, I'm sure the infertility issues will be taken care of. So let us begin with the fact that, you know, when a woman and a man, or a husband and a wife meets, you know, before the woman stands up, the semen comes out of her body. What is the cause of this, and how can they handle it?
All right. Thank you very much, madam, for that question. First, I should say that a normal semen should liquefy within 30 minutes of ejaculation.
When you say liquefy, it should turn to water?
Should turn watery, yes.
Watery, okay.
Within 30 minutes of ejaculation, if there is no problem. As a matter of fact, semens that are thick pose problems to infertility in terms of the swimming, the ability of the sperm cells to swim.
Okay, so it becomes sticky.
Yes, it's like comparing a fish inside water and a fish cast out of water and put in the mud. Which one swims better? Obviously, the one inside water will swim better.
Swim better, okay.
And so that is it. That's the situation that that comes closest to that. Now, normally, during sexual intercourse, after ejaculation, the semen turns watery. And if the woman stays in position, either lying down or reclining or standing up, it is expected that eventually some will flow out. I need to say that this is never a cause of infertility. Every woman experiences that. Now, the act of ejaculation is like running a marathon. When you flag off a marathon, many people, millions of sperm cells
will come out.
Yes, will come out, and eventually and immediately, many will find their way into the neck of the womb and into the womb and upward through the tubes on their way to meet the eggs. Right, in about 30 minutes, it's been shown that we can demonstrate sperm cells inside the tubes on their way to the eggs. So this is not a cause of infertility.
So when the semen comes out, when the woman, you know, is still lying down, it's not a cause of infertility.
It's not a cause. Every woman should experience that, except the quantity of semen is not It's not remarkable.
Okay.
But every woman should experience it at one time or the other during sexual intercourse. The important thing here is for our women to know that this is not a recognized cause of infertility.
Okay. So they shouldn't panic about that.
Yes. Okay. Unfortunately, many women go from one hospital to the other trying to cure what is not actually a disease.
So that's not a problem.
It's not a problem.
Okay. All right, it's good to know that that's not a problem. So if you meet with your husband and the semen comes out, it's not a problem because it is supposed to come out. It shouldn't stay there. And doctor has said that if it is too thick, the semen might not be able to move freely to go fertilize the egg. Am I correct?
Yeah, correct.
All right then. So let's take the next one now, and that is inappropriate lactating. You know, some women, they are not pregnant, but milk is coming out of their breasts. And you know, this is a sign for worry because they've been told that this is a sign of hormonal imbalance, and that because they are lactating, right, it is not likely to get pregnant because they are not ovulating.
Thank you very much. I will seize this opportunity to talk generally on hormonal imbalance.
Okay.
Incidentally, the commonest imbalance is a multi-hormonal imbalance and results in what we call polycystic ovarian syndrome, which is PCOS. Now, that's the commonest imbalance in the world and accounts for about 30% of all imbalances.
Okay.
Now, the one you just referred to is called hyperprolactinemia, that is excess of prolactin in the blood.
Okay.
Sometimes this shows up as inappropriate milk secretion.
Okay.
But I need to add that if a woman presses her nipple,
okay, and milk comes out,
yeah. We have to be careful. Is it milk or the watery discharge? Okay. There is a naturally occurring watery discharge around the nipple.
Okay.
Because the nipple is a summit of pipes that brings milk. So when you press, the water that comes out is like a whitish but light fluid. That is not inappropriate secretion. The one that is worrisome is the one that appears like frank pig milk.
Like pig milk. Pig milk, okay.
Yeah. A little bit yellowish.
Okay.
A little bit thick.
Okay.
And it's usually copious.
When you say copious, what do you mean?
Copious means it's much. You don't expect
it's much, okay.
You expect this type of situation in a woman that is breastfeeding. Okay. So if this occurs outside breastfeeding, it is called inappropriate milk secretion.